if you do not get to the nervous system, you will never gain control of the muscular system. But if you gain control of the nervous system, the kicker is you generally don't have to do anything to the muscular system. Nothing can replace your mental health. Okay? So, if you go on Reddit and you say, should I be a physical therapist? It is not pretty. And when I got into this profession in 2000 and whatever it was, 5, when I graduated from PT school, I had never met someone who didn't like to be a physical therapist. Yo, everybody, what's up? Physical therapist Dr. Ryan Whelton coming to you from just outside the getting hot Tampa Bay area. I treat other conditions, but most people have 2 to 3 issues. I treat the chronic pain world. And the kicker is I develop protocols. So anybody can do what I do in terms of cut, paste. Now I'm also on Spotify. Follow me on Spotify for more in-depth teachings. You can follow me on YouTube, Whelton Methods, Spotify, Whelton Methods, and Apple Podcasts, Whelton Methods, as well as every social media platform, you name it, I should be there, okay? Under Whelton Methods. All right, so today we are talking about TMJ. So, years ago, I started seeing these TMJ patients when I first opened my business, 2009. And I noticed that these TMJ patients, they all had tight masseters, tight pterygoid muscles inside. I used to go in and release them with my thumb. The typical story of a TMJ patient by the time they got to me was, I've been to my dentist, oral surgeon. They usually don't have AVN, avascular necrosis. The bone dies. They usually don't have a disc issue. Otherwise, the surgeon would have recommended surgery type thing, right? So what I started to ask myself is, if you've been following me for a while, I'm a very deep thinker. So I always want to know the why behind the why. So okay, great. They have a spasmed, pterygoid muscles. Yeah, but why would that happen? Because the medical system just, let's inject it, let's do this, let's do that, let's paralyze it, whatever, with Botox or whatever they're doing. Like a current guy I have with headaches. I had him on a headache, watch my video on headaches on Spotify or on YouTube, and I had him on a headache pain gone, boom, 60 seconds. And they were about to start, neurologist was about to start injecting Botox in his neck. Why? To paralyze the muscle. But the real question is why did the person have tight muscles to begin with, throwing off his C2, right? And occluding the vertebral artery. And the answer is that the person is stressed, okay? So, when it comes to TMJ, years ago, I started seeing people with tight masseters, tight pterygoid muscles, right? I'd release them, but of course it comes back, right? And I started asking myself, yeah, but why would that happen? And then one day I was like, these people are stressed, okay? Now, you notice that TMJ patients, a lot of them have headaches, chronic headaches, accident. So it's like this stress trifecta up in here. I think we're all, definitely me, up in my head all day long, that all the energy's up here and it just, tightens things up. So when it comes to TMJ, and I started to realize that I was treating symptoms, which I can't stand it. I cannot stand symptom management. I cannot stand it. I think it is nonsensical, where you don't actually really fix the person. Like, my job is to get to the root cause, because if you get to the root cause, then you can truly help that person, So the question is why are these people's pterygoid muscles and masseter muscles so tight? And the answer I found through treatment was that these people all were going like this, especially at night. When they wake up, they're like, oh, my jaw's killing me. I've actually had this. It's really painful. It's like sharp pain in the temporomandibular joint. It's sharp pain that you can get in here. It hurts. Like you couldn't open my mouth to eat. Terrible. Terrible pain. It's kind of like plantar fasciitis. If you had that, it's like this like sharpish pain. It's terrible. It's hard to chew. Everything's hard. So I started to down-regulate their nervous system. So I have a stress protocol. I teach it in my rehab results course. And I started to turn these people's nervous system, the volume down on it. And because what controls the muscular system? The nervous system. So everybody focuses on the muscular system. We get massages to relax our muscles. We take skeletal muscle relaxants. We inject things with Botox to relax the muscles. But the real question is what causes the muscular system to have too much tension in it? It's the nervous system. And if you do not get to the nervous system, you will never gain control of the muscular system. But if you gain control of the nervous system, the kicker is you generally don't have to do anything to the muscular system. So, because that's what's causing it. So you just turn the volume down on that, and then the muscular system relaxes. Okay? So, with TMJ patients, I calm down their nervous system. And when I calm down their nervous system and turn the volume down, usually they have a great response to it, and usually the TMJ is gone. Okay? I have a patient currently came to me for back issues, but mentioned that they had TMJ. Can you help me with that? Oh, by the way, can you help me with that? And I'm like, is there anything wrong with your disc? No. Went to a dentist type thing. Anything wrong? Anything wrong? Did they say anything about something called avascular necrosis? No. Okay, this person's stressed. So one of the things you can do that's super cheap, I think everybody should be doing this anyways, is go onto YouTube and type in the Earthing movie. The Earthing movie. It's got like 10 million views now. It went viral. The reason why it went viral is because it works, and spend $23 on Amazon and buy a grounding pillowcase. So what grounding does is, if you've ever been to the beach and you're really relaxed, it's because you're grounded. Like you go for a couple of days type thing, you're grounded. So there's like Tesla talked about back 100 years ago or more. He said, I don't need power lines. He goes, there's electricity in the earth. I can just tap that. And anyways, we ended up with power lines. But the electricity, the electron transfer, they explain in the documentary that the electron transfer into your body has a profound effect on your physiology. And they show you it. And it's not woo-woo. It's actually how it works. And they just show you with meters and all that stuff when someone's grounded. Anyways, so if you watch, a lot of people like neck tension. I can usually cut down neck tension 30% just by having them sleep on this pillowcase, right? When you have them sleep on a grounded pillowcase, a lot of times you can get the tension down 30%. In this person's case, the patient that I'm treating now with TMJ, I put her, I use my whole stress protocol in my online rehab results course, but one of the things I did is I grounded her, and I would say 2 weeks, she came in and she's like, look, I don't have any problem anymore. And I'm like, yeah, great. That's how this works. So TMJ itself is kind of an industry. It is dentists will give you mouth guards so you don't grind your teeth usually, but I can count on one hand in 20 years people that told me that helped. Maybe dentists would argue with me and say, oh no, I can help people all the time. But if you don't address the stress, then, You may be protecting their teeth type thing, or maybe it changed the position of your jaw and helps it there, but it's a more holistic approach. But like, that's how it all works anyways, with a whole, people say like, oh, like holistic doctor. So you're telling me a doctor that takes in everything and doesn't just look like, through a toilet paper tube? Like, yeah, no, I actually want that. Like, it's just so crazy to me that like, this is alternative medicine when people start asking you about stress and people start asking you about your diet. Like general doctors don't talk too much about that. Anyways, be open-minded and try things that are safe, So anyways, that's that with TMJ. It's actually pretty straightforward. Now, let me say this with TMJ. TMJ patients are the least compliant patients I have ever met in my entire life. They generally don't complete their treatment plans. Years ago, probably 10, maybe more, 10 years ago, I'm like, what is wrong with these people? Why don't they like why are they so resistant to getting help, And the psychologists will say that people that have anxiety, right, that it's safer to suffer because it's familiar than to break free of that and calm down. And I actually think that's what's happening there, is because this is a stress treatment and you're calming people down. And sometimes there's a subconscious resistance to that. And to me, that's why they are, in my opinion, the least compliant patient population I've ever seen TMJ patients. It actually fascinates me. So anyways, that's what I believe is going on there. I've been using this protocol, like this patient that I have right now, who in 2 weeks, she doesn't have TMJ anymore. With my rehab results course online protocol for stress. There are big changes happening to Whelton methods. So I am restructuring everything. So for years, people have asked me, message me, email me, DM me, whatever, and said, or call my office and said, I got a patient with this condition, that condition, I can't figure it out. Can you ask him, or what do I do about it? That type of thing, right? And I used to teach live, but then I put everything online, all my courses, and then I kind of lost communication with our community. And but I'm going to change that. So what I'm going to do is start to teach. I'm going to start to teach in groups on Zoom. And not only will I teach, but people that have tricky patients that they're working on can bring that patient in, and the whole group, we can all learn together and diagnose, develop a treatment plan, and usually fix the person, okay? So it should be really cool and really informative. My goal in this is to get people out of a very low success rate in physical therapy. It's lower than you think, okay? Up into the 99%, right around there. I want everybody at 99%. I want us like AI treating machines that can fix people. When I was teaching live, I went to a state and there was a COO of a major corporation, physical therapy corporation, like one of the big chains. And I asked him, because I'm curious to like what is going on in this profession, like how are we doing, And the COO said, I asked him specifically, so I knew he knew the numbers. And I said, what percent of your patients get better? He said, 50% quit. And of that, 50% get better. And I'm not good at math, but I did the math in my head and I was like, whoa. I'm like, so you're telling me 25% of people that come here get better? I'm like, whoa, man, whoa. I'm like, that's not good. So what I find is that a lot of people, new grads, maybe 50%, they can get, their success rate is. The ones that have been doing it for 20 years or something like that and can tolerate, not the box, but outside the box, they're 70, 80% the good ones. But I still think that we can all get much higher, okay? So there's people I got a guy in Europe that went from, he's one of the good ones, 80% to around 99%. He posts about it. 99% of his patients just applies my protocols and boom, patients get better. That's my goal, is to get us all up in and around that area diagnostically. So we're on point diagnostically, and then also treatment wise. I want everybody to be treating machines, okay? If 25% of people are getting better in physical therapy, it's kind of like, what's the point, man? You know, like when I heard that, I was like, whoa, that's crazy. So, but we are going to change that. And I know people that have been following me for years are doing amazing things. And they message me and they post about it, about all their results that they get. And they even advertise it on their website that 9 out of 10 people that come here have immediate relief and get better, you know? So it is pretty remarkable, okay? So if you would like to learn my protocols, everything is online in Whelton Methods. So you can take my rehab results course, which is all my orthopedic protocols. I have a pain management doctor, good for you, man, good for you, that is doing my sciatica cervical redic course and loves it. And instead of injecting, he's using this, which is amazing. I do not agree with those things. I've heard some people say it's good for you in the first couple of years type thing out of college. No, it's not. Mental health crises are never good for you. I don't agree with that. No matter how much money they're offering for a signing bonus, nothing can replace your mental health. Okay? So, if you go on Reddit and you say, should I be a physical therapist? It is not pretty. And when I got into this profession in 2000 and whatever it was, 5, when I graduated from PT school, I had never met someone who didn't like to be a physical therapist. I never met anybody. Everybody loved their job. You saw one patient at once, you could see him a whole hour, and the insurance company would pay you for that. And then Obamacare came in, and now it's like $20 co-payment, no matter what you do, no how long you spend with the patient. $50 is absolutely insane. So then people have to see 3-4 patients at once. And now we have PT mills. Plus some of these companies are beholden to Wall Street, which they have a fiduciary responsibility to make money. So you are a cog in a machine who can bill. And I am not a fan of those places. And when my patients come from those places and get mad that they didn't get attention there, or they got stuck in the corner to do their exercise, I'm like, it's not their fault. I'm like, it's just this system that we're in, you know? So hopefully one day that will change and people can love what they do again. But my recommendation to those people is that if you want to open a cash-based business, I will teach you how to do that. But if you are not the entrepreneurial type, cash-based businesses, they are hiring too. They hire too, you know, and you can spend a half hour, 45 minutes or whatever they're allowing you one-on-one with a patient. And that is what I recommend if you're an outpatient ortho. So you can get out of the burnout, you know, the MDs get burnt out because of what's going on in healthcare, and PTs are right up there with them, you know. I mean, it's crazy what they do in this whole PT world, in the healthcare world, you know, and it's not healthy, and it's not healthy at all for any amount of money to have a mental health crisis. It's not good, in my opinion. I think most people would agree with me on that one. So anyways, I say if you have any type of entrepreneurial spirit in you, then chart your own course, do it yourself, and help people the way that they're meant to be helped, and don't listen. So you don't have to deal with insurance companies telling you what to do or how to do it or what, denying this, denying that. It's totally ridiculous. Insurance companies, if you ask me. It's like this necessary evil in our society that just doesn't cover what you want it to cover, like it's totally insane. So hopefully that'll change. So anyways, that's that. Drop a comment, let me know if something you want me to talk about. I'm also publishing a paper this summer. I will publish a paper. I will keep you in suspense about what discovery I am publishing. It'll be pretty helpful to a lot of people. We'll say that. Really cool. I actually wrote the paper, forgot I wrote the paper, and like 3 years ago, and then I went back to see, I was like, did I write a little bit of this? And then I realized it was almost totally done. Data table, everything. I had done like most of it. So it's not that much work for me to do, and I'm going to get that out to the world. Okay? I will publish that hopefully this summer. Okay? Other than that, peace. Love you all.